Good morning, guys. It's Dr. Eric, your fitness physician and peptide doc here in Columbus, Ohio. Just doing a very short video. I'm going to talk about testosterone, andropause, and low T. Obviously, a big topic for some time, and been shooting some videos, both me in person as well as some of these type presentations to present some data. I can't draw these on my whiteboard because my handwriting, as you know, is terrible. So, testosterone and andropause, we all know that unfortunately our testosterone levels do start to decline, as do a lot of the other hormones, both men and women. Very, very important for both. With that, there's a symptom complex, and there are some associated comorbidities, or there's morbidity and potential mortality. So it's not just an aesthetics thing; it has health implications, which I will talk about. So, increasing incidence today, as we know, especially with all the the xenoestrogens and pollutants and toxins in the air, the food, the glyphosate, all the different things. Everybody's stressed, eating poorly, not sleeping. All these things contribute. So it can be up to 40 to 45% in men 40 and older nowadays. This certainly didn't happen generations ago. It's definitely more of an epidemic at this time. It basically, your testosterone levels can, basically start dropping each decade after the third or fourth decade of life. Sorry for the typo on here, put increase, but decreases by anywhere from 10 to 15 to 20%. It can start as early as your 30s. I've had guys in their late 20s and 30s coming in with symptoms, so it can definitely happen. Here's just a quick graphical representation showing age and decline of testosterone as well as free testosterone, how it drops over time, especially and starts getting more precipitous as we get older, unfortunately, 40s, 50s, and 60s. So the most important thing is, what's going on? Where are you? Symptoms and signs. This is the biggest thing that I use to guide my therapy. It comes in a different domains such as mental, physical, and sexual. Biggest things mentally is most guys are having some mood changes, brain fog, drop or decrease in motivation and drive. Just that get up and go, that pizzazz. They get the grumpy old man kind of syndrome. Can be depressed. Some guys can be depressed and down. Some are more agitated and anxious. Sometimes it's a combination of things. They're just not thinking right. Just don't want to go to the gym. Don't want to do anything. Physical can affect many different things, such as decreased exercise tolerance, disrupted sleep, fatigue, just having problems putting on muscle. They're losing muscle and they're building fat, which is the opposite of what you want, right? Sexual domain, of course, this is one of the main reasons guys come to see me is because of poor libido, poor stamina, and lowered sex drive, and erectile dysfunction issues. So again, these are some of the common symptoms: libido, loss of body hair, hot flashes, gaining fat, losing muscle, malaise, anxiety, decreased energy and motivation, decreased drive. These are the biggest symptoms, and again, there are some that are many, many more. But as I mentioned earlier, there are medical concerns too. Studies have clearly shown the benefits of testosterone therapy, and that with decreasing testosterone, there's a higher risk of osteoporosis, anemia, sarcopenia, and quite frankly, earlier mortality. Those with better and higher testosterone levels, quite frankly, live longer. They have less heart disease, less diabetes, less insulin resistance, less incidence of metabolic syndrome and coronary artery disease, and less sarcopenia and osteoporosis, which is massively important, especially today, as we're losing muscle and losing our bones. If you can't support yourself or get up and do your activities of daily living, or you lose your balance and you fall and you get a fracture, you're done at that point. So a lot of major health issues as well. So it has many health benefits in prolonging life and improving your health span and improving the lifespan as well. So these are the things we want to address as well, and not just the aesthetics, looking better, feeling better, but they all kind of are important together. So one of the things, I'll go through a questionnaire with my patients, but one of the common ones you'll see in a lot of doctors' offices is the ADAM questionnaire. It's called the Androgen Deficiency in Aging Male. And I did a whiteboard presentation on this. This is a little bit neater because, as you know, my handwriting sucks. So here's the questions here. Mostly libido, energy, strength, height. I'll let you guys read through it, but basically, if the answer to yes to more than 3 questions, especially yes to number 1 or 7, more than likely you may have low testosterone. Again, I use this as a guide with symptoms in my patient's interview. This is the art of medicine and tweaking things and understanding what's going on. Causes we'll get into in future videos, but age, of course, and we mentioned poor diet, or nutrient poor, calorie-rich, fast lifestyle and food, toxins in the air and the water, all around us. Unfortunately, getting worse and worse every day. Stress, people working harder, sleeping less, emotional stress, physical stress. Again, this ties into lifestyle. All these things can be corrected or improved upon no matter what. And sometimes this is all it takes, just a change in lifestyle, exercising, tweaking the diet, and that's all you need. Some guys will need medical therapy, and of course we can help with that as well. We'll get into lab testing in other videos. I've already posted a nice one about labs, but typically we'll do a full hormonal panel. This is your basic panel here, but depending on patient's condition, health issues, may do a more comprehensive panel looking at inflammatory markers, markers of neuroinflammation, advanced cholesterol markers, advanced neurologic markers, testing for immunity, any micronutrient deficiencies, gut testing, many things we can do. So hope you guys enjoyed this, and stay tuned and watch all my other videos, and I'll give you more information. Please reach out to me with any questions, or if you want to do an online consultation, happy to help. Everyone have a great day. Dr. Eric, enjoy.